Good morning, good afternoon, and good evening, everyone, from wherever you're joining us from. I'd like to welcome you to the Subjects That Matter Most webinar series. I'll just wait for everyone to get joined on with us. But while we're waiting, if you'd like to put in the chat box where you're from, feel free to do so we can see where everyone is joining us from. I'd like to go over a few things. So today you will be muted just so we can have Keith give us a perfect presentation. If you have any questions, please feel free to ask in the chat box or question box, and we will be answering all the questions at the end, unless there's anything that I can answer while he is presenting. All right, so today's Subjects That Matter Most webinar is a global rural collaboration, student nurses engaging with community health assessment sustainable education, the CHASE model to reduce health disparities. Today we have two sessions. Keith Whitten will be presenting session 1 and Ms. Jean Ross will be presenting session 2. They would love to have presented together, but with time zone differences, we will be doing things a little differently. Keith and Jean have presented this presentation many times, and so although Jean will not be here, she has recorded her piece, and that is in the presentation today. Keith has been a local authority inspector advisor and a passionate advocate on how new technologies transform learning and teaching. Having taken early retirement, Keith moved to Shropshire 6 years ago and is now a full-time musician. He chairs the Bishop's Castle Community Partnership and is a college governor. So without further ado, I will hand it over to Keith.
Hi, everyone. As you said there, I'm Keith. I'm going to take you through the presentation and I'll chat a bit about it. So hopefully you find this interesting. What we're going to go through is in the objectives here. Give you a bit of background to the project that we've been working on for the last 3 or 4 years, its purpose, a bit about what we're calling the CHASE model, which Jean Ross will talk to you about in a video that she's going to present. And then I'll talk to you about that in action, really, where I live in Bishop's Castle up in Shropshire in the UK. I live in a very rural part of England in the hills in a beautiful old house. You might be interested if you can see the beams behind me, that cross beam that goes across the top of the wall there. We just had it dated. The timber was felled in the winter of 1531. So that gives you a flavour of how old Bishop's Castle is and its nature, and we'll talk a bit about that. And then we'll look at implications to the future and how things we see going forward with this particular model. So without further ado, thinking about the background really, in terms of what we're looking at rural urban health inequalities, and we're particularly looking here at rural issues. There's a lot of work done to do with issues in urban areas, but I live in a very rural area, very remote rural area, and Jean and a lot of New Zealand is very rural as well. And we feel that rural areas are sort of overlooked and the issues are becoming more and more marked in many ways. They don't get the press because you haven't got the huge numbers, but the issues and the impact on individuals, and communities' well-being, health and well-being are really quite significant. And we've noticed obviously with the effects of COVID-19 that's got even worse. So it struck me a long time back that we needed to be looking very much at rural inequalities here. Before this particular project started, I wrote a paper, I started writing a paper about the health of a rural community and the idea of working towards a resilience and sustainability in a rural area. And that led to me talking to Jean when we went to Iceland on a holiday to see her son playing ice hockey. And we got talking. I'm an ex-geographer. I'm not in the health area, but I got quite passionate about my community and what we needed to do to help it well-being, and Jean was coming from the nurse training background, and our two ideas sort of came together, and they found some joint there in terms of this project. Social justice, I think, is very important in this. The nurse's contribution here. There's this quote which Jean has put up here, that population health is defined as an approach that focuses on interrelated conditions and factors that influence the health of populations over the life course. And it's about trying to do something to improve the health and well-being of those populations. These inequalities need to be addressed, and the whole of this project has really been very much about that. So we've created, really, or Jean's created with her colleagues in Otago Polytechnic, a global collaboration. We're the English bit, Jean's obviously the New Zealand bit, but you can see there's other parts of the world that are very much part of this particular collaboration. That's the area I've been involved in working with the project. From the point of view of Otago Polytechnic, this actually fits into a Bachelor of Nursing program. It's a 3-year degree course, and within that there's a strong commitment to the concept of community partners and the idea of looking at rural communities as clients. So students learn community assessment skills. They're guided by a community as a partner wheel, and they use processes. It's a sort of what Jean calls a windshield and foot survey of the neighborhood where the client lives. And they get an exposure to an area that isn't their own, and they look at this area in an objective way. Their course goes on and it builds on this particular model. It uses a whole series of frameworks, which we'll explain as we go through this, and it's based on the Ottawa Charter and the sustainable goals of the UN 17. And we're calling the model the CHASE model. And now I won't say any more about that, but what I'm hoping you'll be able to hear Jean in a video presentation telling you a little bit more about the CHASE model.
Can you turn it up on your computer a little bit, Keith?
It's on full. That's maximum, I'm afraid.
I may need to see if I can share it on my computer. One moment.
Sorry, it's the full volume on this.
started off very small and it has grown to be a very large endeavor.
Can you hear that okay, Keith?
I can hear it okay, yeah.
Okay. Is this the right beginning?
Well, do you want to go back to the beginning of it, or? Oh, I don't know what that is. Sorry, that's a different video. Sorry, I see what you mean. Okay, there. Yeah, go from there where you had it. Yeah, that's fine.
Okay.
Otago Polytechnic with the student nurses. It started off very small and it has grown to be a very large endeavor. So we started off, when I say small, we had maybe 2 or 3 projects we undertook each year with the third year nurse learners in the Bachelor of Nursing program. That grew to now 110 nurse learners in the year 3 Bachelor of Nursing program engage with community development research projects. What that means is we divide them up generally into groups of 10. So that could be anything between 10 and 12 projects, substantial projects that we are undertaking here at Otago Polytechnic. What it means is that the students work in geographical locations that are assigned to the student, generally in rural areas. Dunedin sits within a large geographical location, much of which is rural and isolated populations. What we like to do, we like to work alongside and with community to discuss what they seek as their health needs, and the students then work on those health needs to come up with health promotion message and resources that students have developed. We then go back and look at the impact that that has had on students. One wonderful example is last year's students worked in a location and they developed beer stubbies, which keeps your beer or your Cokes cool in the summer. The message that they were working with the population they identified was the mental health of farmers. Down here in the south of the South Island in New Zealand, there is a well-known notion that that's of the Southern man, which is the man that has a very rugged life, works with dogs, works on the farm, and is a tough, and drinks Speight's beer. And so the idea was that they wanted to improve the communication of farmers, because the suicide rate of farmers and the mental health conditions is very large in New Zealand. They developed a health promotion message, they put it on a stubby, and that stubby was shared amongst the community. One person spoke to another person, and what happened was that there was a national campaign called Will to Live occurring in the town called Balclutha, and they contacted us and they asked, would we sponsor 200 of these stubbies to be given to each of the farmers that would be attending. Not only did we do that, but we were invited as well. So we attended the evening, we presented the stubbies. Each of the farmers loved them, and now it has gone national. So the organization Will to Live have now purchased 1,000 of these stubbies to go around New Zealand spreading the message. That's what we believe is part of nursing practice, making a difference, but also about the sustainability and being sustainable in our society. Thank you.
So I'm Sam.
Okay, so shall I go back to my screen?
Yes.
Oh, when you have to stop. Right, apologies for the slight hiccup there, everyone. Hope you can hear me again now. Moving on with the presentation. So Jean was talking there about the CHASE model, which is community health assessment, sustainable education. The idea really is the concept of this living lab concept, where students are looking at real areas, it's about looking objectively at rural communities, and it's also then about looking at health promotion models and strategies to reduce health disparities. So it's actually really quite an interesting model in terms of students identifying, looking at data, understanding how an area has particular needs, really then interrogating by asking the community about their issues, learning about the concept that these people have, and then coming up with some solutions. So it is quite a holistic model in that respect. So that's what it looks like. For me, it's quite interesting, really, because we used Zoom before lockdown. This last COVID lockdown period in the UK, no one really knew what Zoom was beforehand, but now everybody does, because that's what we seem to live by for a long time. But we've been using it with New Zealand for a while beforehand, which is quite interesting. So the student nurses collaborate virtually using Zoom with the community that they're working with as a partner. And it's about getting feedback, it's about networking, it's about learning. So it's quite an interesting relationship, because you do get to see and meet these students from a community perspective, and it worked really, really well. I think I might have missed a slide out here somewhere along the line. No, I don't know what's going on. Bear with me, sorry. So the Chase model is based on Anderson and Macfarlane's Community as a partner wheel. Jean and her colleagues adapted it slightly, because they've added a few of the various themes in here. The theme of housing, which wasn't in the original Macfarlane model. Very important in a place like Bishop's Castle, where I live. Housing is a major issue in a rural area. Also, climate change is becoming a very serious issue for us around the world, but I don't know where it's like where you are, but it dictates all our policies now, quite rightly. And in a rural area like Bishop's Castle, that has really quite significant impact. We're looking for the moment at most of our homes being heated by heating oil in Bishop's Castle. We don't have gas. By gas I mean not oil, I mean gas, so here the only heating we have is heating oil or wood stoves, and those are extremely polluting and they're not sustainable in the long term. So we're looking now quite seriously at putting in a wind turbine for the village, a community wind turbine, and potentially a heat network where water is pumped, hot water is pumped to all the houses. Now that's really important, but it really hits the idea of community well-being, and it's about communities working together. And then the other one that's fairly obvious that we need to consider is the impact of COVID-19. So the model has been adapted slightly to include those areas. Right, I'm going to talk a little bit about the project that I was involved in, the case study here at Bishop's Castle. This is Bishop's Castle. This is the view from my house, I'm very lucky to say. It's a beautiful little town. We're very, very remote. It's up in the Shropshire Hills. We're about 850 feet above sea level, which for UK means it's one of the highest settlements that there is. It's a tiny little place, but very, very beautiful. We're very proud of it. I'll tell you a little bit more about it. It's right on the Welsh border. If you find Birmingham on a map of the UK, Birmingham is the second largest city in the UK, and you were to travel due west from Birmingham, when you get to the Welsh border, you've just gone through Bishop's Castle. That's where we are. We're due west of Birmingham, and we're right slap bang on the Welsh border. Very historical area. If you've ever heard of Offa's Dyke, which separated Wales from England, that runs along through Bishop's Castle. It's a medieval settlement. We've got a huge number of very beautiful old houses. We're very proud of the conservation area in the middle. That picture doesn't show what I'm about to say, but we've only got a population of 1,893. So it's actually one of the smallest towns in the UK, but it's a service centre for a very extensive rural hinterland. And as you can see from this particular picture, it supports a very significant tourist population throughout the year. And actually since COVID, because people aren't going away on international holidays, we are extremely busy at the moment. This particular picture was taken, I think about 3 years ago at this time of year, when we usually have a wonderful Michaelmas fair, and people come from all around the UK to celebrate in the town. Unfortunately, we weren't able to run it this year, because you can imagine that number of people running around in the street isn't particularly COVID safe, and we didn't feel it was right to be able to do it. But the town really misses that. It's part of the spirit of this town, and the community pulled together to make it a very special thing. We've got a theatre, leisure centre. We're very lucky for a town of our size. We've got a swimming pool, library, community hospital. We've got old people's homes. We've got a business support and resources facility and a business park. We've still got a cattle market. And we've still got 5 pubs and a brewery. So it's a great place to live, but it is remote. And because of that, I think people pull together. We value what services we have, but we are really struggling to support the services we have. It's a struggle to keep a secondary school here. We're fortunate that we actually pull a lot of children across from the Welsh border. If we didn't do that, we wouldn't be able to sustain a secondary school here. And if we didn't sustain a secondary school, then a lot of people would leave the town. So we're on that balance. We're resilient, but are we sustainable? It's quite interesting. So very strong community spirit. And from my point of view, when I came to the town about 7 years back, I was asked from my previous experience, if I would write a community plan, a town plan. And in doing so, we asked the community what the issues for them were. And they were, of course, employment, they were housing, but they were also about the services to support the town and the dwindling services and the fact that there's very, very poor transport. If you need to go to hospital, the nearest town is 25 miles away. There's about 3 buses a day, and they've been threatening to cut those. If you don't have a car, you are really cut off in a little place like this, and it affects your health. And it also means that quite a lot of people here are quite isolated. So the study was looking at the community well-being of our little town, and how we work from our point of view, from a community point of view, is we set up a little core group. We had a doctor from our doctor's surgery, the chap, Dr. Penny, who at that time ran the doctor's surgery. And funnily enough, just by total coincidence, Dr. Penny's first practice as a doctor, when he was almost just a student doctor, was just down the road from Dunedin in New Zealand. So he jumped at the chance to be on this particular project. But we also had a couple of town councillors. We have what we call social prescribers, which is a new thing in the UK, where we're trying to look at the health needs of people that aren't necessarily to do with their physical health, but more to do with their lifestyle health. We have a youth worker on the project to represent the youth, and various people representing various community projects. So it was a great little core team representing the community. We provided initially a whole batch of data for the students. We didn't give them the data. What we did was we gave them links to the data about population, about health stats, about how our statistics fit within the UK, a community profile, videos of the pubs. They got a feel of what it was like to be in Bishop's Castle from an outsider's point of view. We then, before the study got off the ground, we met with the students via Zoom at the start, and we got to know them. The time differences are tricky, but we managed it. They got up very early and we stayed up quite late, but it worked. The core team then had about 3 or 4 weeks where we got emails from the students as they went through the data and they wanted to find out, and they started to unpick the issues for us. They tested things out with us. They asked us all sorts of questions. We had our own areas. So the doctor's surgery obviously was answering stuff about the health service and so on. During that time, they then started to identify some main community health needs, and then they tested those out with us, which I think was really important. They said, we think this is an issue for you, and we guided them. We think, oh, well, I think you're slightly off the mark there. You need to be looking more at this. But it was their decisions, their identification of these needs. And then at the end of the 6-week study, they presented their findings to us during a live video conference, and we opened that to the wider community. And then after that, they provided us with a printed report and some resources to try and help address the needs that they'd identified, which has been amazing. On the left there, you have the poster I did to encourage the community to come along to the final meeting to find out what the community, the nurses had found out about us. And we had a very well attended evening. For a small town like us, it was an evening thing, about 8 o'clock in the evening. We had about 40, 50 people came along to find out, and it was brilliant. The picture at the top to the right there is our core team meeting right at the very beginning with the New Zealand students. You can see the students on the telly there, and we're sitting around the table. We had about a 3-hour meeting with them, just having a chat, getting to know them, starting to unpick the issues. And then the other picture Jean took, I think, and it's exactly the same time, but it's from the New Zealand students looking at us at the same time. I love that picture because you can see both sides of each group there, but it really worked well, and it was fascinating. Kirsten, we've got another video, I'm afraid, here. So do you want me to try it or do you want to take it? This is the one where Poppy is talking about the project.
I have it pulled up, so I will share my screen.
Kia ora koutou katoa. Ko Arthur Te Maunga, ko Wairo Gorge Te Awa, ko Restio Toku Whānau, ko Poppy Toku Ingoa. Tēnā koutou, kia ora koutou katoa. Hello and welcome. My name is Poppy, a representative of the Community Research Group here in New Zealand. Thank you for braving the cold and joining us here tonight. I just presented you with my pepeha, an introduction of myself, a welcome to you, and an explanation of my ancestral roots, all in Māori, the Indigenous language of New Zealand. The last sentence translates to greetings and welcome to you all as we gather as one in mind and spirit to present our work and share our thoughts. I hope this can underlay what we are doing today, gathering to discuss and share research, findings and resources about your wonderful community of Bishop's Castle. So, thank you again for being here. Tēnā koutou, kia ora koutou katoa. Before I begin, I would just like to thank the core team. The core team is made up of various representatives from your community who have helped us in a great amount. They have helped us with our research, they've given us their time. So thank you very much, all who are up on the board, for everything that you've done for us. This is us as a group. We are a 12 year 3 Bachelor of Nursing student studying at Otago Polytechnic here in New Zealand. The community of Bishop's Castle. I'm not going to lecture you on your own community. You live there and you know about it more than any of us do. However, I would like to highlight some points of interest from our initial research. The fact that you guys are a tight-knit community has come through from the very start, and the values of that tight-knit community have come through too. It was very interesting to look into your proud history and English heritage. The differences culturally and structurally between England and New Zealand have also posed interesting. For example, the government structure, the structure of your health system, how things are funded, they're all very different to what we have here in New Zealand. And it's something that we've taken a wee bit of time to get our head around, but it was important to understand these differences and get our thinking into your community mindset. Understanding Brexit, how that affects you as a community. Climate change and how you combat that as a community. The layout of your community, where you're situated, how having borders affects your health. One thing for me personally, converting miles to kilometres, that is still something I'm struggling with to do in terms of like figuring out how that affects your health. What being a rural community is to you and how that affects your health. What resources are available to you and what resources aren't available. All these things were covered by our research using the community wheel, which Jean would have gone over before. This is our first stepping stone to understanding what it's like to be in Bishop's Castle. We gathered primary and secondary data in our research. The primary data came from the core team, who we were emailing and Skyping throughout the last few weeks. The secondary data we collected online. From this data, we came together and collated a mind map, which you can see on the screen. The mind map consisted of potential gaps or health needs in your community and potential vulnerable populations that you have in your community too. From the mind map, we then narrowed down further to what 3 health needs we wanted to focus on for our literature review and potential health promotion message and health resource to develop at the end. These are the 3 broad topics that we came to in the end: transport, mental health, and physical health. We then split into 3 smaller groups to begin further research into these topics. I'm now going to hand over to 3 of my colleagues, one from each of the smaller groups, to go more in depth into the direction we took once we split into our groups. They're going to give you an overview of the rationale into why we chose this as a health need for your community, an overview of the literature that we found on the health need, the health promotion message that we developed using the Ottawa Charter, and the health resource that was made for each health need. So now I'm going to hand over to Sophie, who is going to start with transport.
Hi, I'm Sophie. I was working with my group on the transport side of this project. Transport is a fundamental aspect of a community, providing access to many integral services while also offering a great deal of freedom to move around a given area. In a rural area, due to scarcity of some social services, transportation is of particular importance. We identified public transport as an issue, as public transport does not cover the needs of the community. Buses only travel to nearby towns of Ludlow and Newton once per day, and council budget cuts continue to threaten transport to Shrewsbury. Another issue was disabled parking. The parking spots are inaccessible due to frequent misuse by non-permit holders. This is attributed to inconsistent markings, lack of signage, and the absence of any parking infringement enforced. Due to a high elderly population in Bishop's Castle, a higher than average portion of the public could be afflicted with mobility issues, making those affected a large portion of the population. These issues have a major effect on health, as lack of public transport puts particular importance on vehicle access, therefore accessibility is only possible with sufficient parking. For the disabled, a lack of designated and available parking has a significant health impact. Without this resource, those with disabilities may not be able to utilise available social services, resulting in detachment and isolation from network of facilities. From our research, we have highlighted a trend between rural communities and transport poverty. Transport poverty is commonly associated with rural communities. There is not enough funding, resources, or populations to drive the need for improved transport. Our research also highlighted 2 common minority groups, the elderly and the disabled. These minority groups are evident in Bishop's Castle in terms of transport and accessibility. The literature we reviewed further highlighted and reinforced the information and concerns that the core team of Bishop's Castle had already addressed. The Ottawa Charter is a health promotion framework which outlines the fundamental aspects needed for community health. We have used this model to identify health promotion opportunities within Bishop's Castle, the most important being raised awareness of correct use of disabled parking. From here, we moved on to our health promotion resource, a written submission to the Shropshire Council with 3 recommendations: better signage and road marking of disabled parks, repercussions introduced for incorrect use, and increased education regarding why incorrect use is important. Attached to our submission was a flyer that we have developed to be placed on non-permitted cars using disabled parks. The aim of this is to provide targeted education about the importance of correct use with the aim to prevent incorrect use reoccurring. Thank you.
Hello, my name is Lucy and I am speaking on behalf of the physical health group. Physical health is the 3rd health need that we have identified for Bishop's Castle. We identified these as being key factors that impact physical health. Having a well-balanced diet and getting regular exercise is important. Food poverty leads to numerous health complaints. Maintaining good physical health is important to sustain well-being. There is a high prevalence of obesity in Bishop's Castle. Drug and alcohol misuse significantly impacts physical health. And smoking was an issue that was expressed by the core team in Bishop's Castle. From this, we aim to identify incentives to better manage these issues. We researched the effect that diet, exercise, and drug misuse have on physical health. For diet, we looked at the effect of Brexit and how this will impact on food prices, and the lack of education around maintaining a good healthy diet. For exercise, we looked at physical activity of both youth and older adults in the UK, And for drug misuse, we looked at the short and long-term effects that drug misuse have on physical health and the effectiveness of smoking, services, and drug prevention education. From our findings in the literature review, it reinforced the concerns that were raised by the core team in Bishop's Castle. We used the Ottawa Charter Health Promotion Framework to identify an opportunity for health promotion. We found that education was needed around gardening and the benefits that community gardening have on maintaining good physical health. From here, we created resources, which is a beginner's guide to gardening. It explains the benefits of gardening and provides households with tips on growing their own produce. These resources are available as a poster, coaster, and a magnet so that the message is available to all members of the community.
I'm Natasha Gray, and I have worked on the Sustainable UN Goals, and I have related it to the community of Bishop's Castle. So the United Nations developed 17 goals to attain a more sustainable future. These goals acknowledge the current global challenges, including poverty, inequality, climate change, environmental degradation, poor education, peace, and justice. For these 17 sustainable development goals to be implemented by the target year 2030, they are all interconnected, so no one is left behind.
At the completion of the projects, the students are encouraged to utilize the impact assessment research template to go back to the community, either physically or virtually, to ask the stakeholders what impact did the health promotion message, health promotion resources have on the health of the community.
Okay. Right, back to me, I think. Hopefully you can see this, can you?
Now you have to share your screen again.
I don't know, yeah, bear with me, I've lost it. Right. Right, we're back again, I hope. Yes, so that gave you hopefully a flavour of the students' presentation to us and some of the things they found. They mentioned physical health and the resources there. Following on from that, we've done a lot of work in Bishop's Castle. We're setting up a seed bank where people are storing seeds for the future. We've set up a community larder, taking waste food products from supermarkets and actually distributing to people, and we've now also, sadly, because of COVID, had to set up a food bank in town. So there's a lot of work that follows on from the physical health things that the students noticed. The mental health one is very important to us. What they didn't say in the thing there is that they identified that we'd had something like 6 young suicides within the previous 2 years of the study, and in a small town like that, that's disproportionate, and it's very marked here. And if there's a suicide in a small place like this, everybody knows the person who committed suicide, and these are often young men at the moment in this town, and it's become a really horrible issue for us here. But it has led to some good, I think, in terms of us challenging that issue and trying to actually sort it out. And in fact, we won a small bid recently based on the work that we've done with New Zealand, because we were able to show the evidence. This was from the Cameron Grant Memorial Trust. Cameron Grant committed suicide himself. He was 21. He hid the fact he had suicide. No one knew. And the aim of the grant is to preserve and protect good mental health, particularly in younger people. And what we're doing with that is to create a Moodle online virtual learning resource that has a lot of information, support for youngsters with mental health issues, or just youngsters anyway. And after COVID, there's an awful lot of people that this is addressing. The students then came back with this rather nice little sticker there, which your mind matters, and it says you can't put a plaster on your brain, which we quite liked. And that's in development, that particular Moodle resource, but it comes out of the work we did with the students. The other thing that we were already doing was working with our community. We have a lot of care homes here, and dementia is an issue. We are now officially a dementia-friendly town, and the students have helped us with some resources like this to help support that. Stickers for the shops that are supporting dementia, friendly practices and so on. So there's a lot of good that has come out of this study. I'm conscious of time, but I just wanted to evaluate where we were. These are our reflections of the study. We were very impressed with how the students picked up often very hidden issues in our community to do with health and well-being, and they reflected them to us. Now, they may have been obvious for outside people to see these issues, but they weren't necessarily obvious to us. And I think that is a really interesting thing, where you've got someone coming to look at you and reflect back to you what they see. So the fact that the new student nurses stand in the shoes of the community they are studying helps to address these issues, and being so remote to the target group makes them completely objective. There were a couple of issues. The time zone differences were easily overcome, and I think, as Poppy mentioned, we did notice some really interesting subtle things to do with the way that the NHS works in the UK compared with how health is funded in New Zealand. And it was a really interesting learning curve for the students. Some of their things initially they came back with were very naive because they didn't fit a UK model, and they had to learn about how our systems work. And I think that was an interesting thing for them to understand as well. So implications for the future. Jean mentioned in that the impact assessment evaluation, and that's ongoing. We've done a lot of impact assessment on this, and I know that's happening across the world with the studies that are happening. It's also interesting that as this study grows into different areas, we're capturing different themes that are coming out. So mental health, for example, is becoming a recurring theme. It's a very big issue in the UK, especially after COVID, but it was here already. And what's sickening to me, I'm sorry to say that, is that it's so badly funded. There's a lot of talk about it's good to talk if you've got mental health, but it's not easy to get support. And having this evidence is really powerful to try and lobby for more funding to support mental health. And I'm sure that's happening across the world. So from my point of view, it's been extremely important. There's a list of resources there, which I think you'll be able to pull up and look. And from my point of view, thank you very much for listening. I hope it's been interesting, and I'm happy to try and answer a few questions if that helps now. Okay, so stop sharing, shall I?
Perfect. Yeah, if anyone has any questions, please let us know in the Q&A box or in the chat box. We'll just wait a few minutes for those to come in. Someone did ask if they'd be able to access the recording afterwards, and yes, it will be on our website, as well as our networking platform that actually just went live. While we wait for some questions to come in, I can share that so you're able to see. This is something that GRNEN has been working on for a while now. And this is a networking platform for anyone to be able to join on and join the conversation. This is free to everyone, so it's a great opportunity. Build relationships, ask questions, exchange ideas, anything like that. So I will put in the chat box a link to that if you're interested. And I don't see any questions coming in quite yet. Karen says, this is such an amazing partnership between a rural community and an SON. I hope to emulate this for our own SON. So happy to hear about the networking platform. I'm very interested in future partnerships. That's wonderful, Karen. Keith, what are some tips you might have for anyone who's interested in starting something like this?
From a community point of view, you need to have a community group, I think, established to be able to think about, your own needs, and you need to set up that core team. That core team is critical, and it needs to represent different aspects of the community. So as I say, the medical side, the doctor's surgery, because there's all sorts of questions that are going to come through that, but also representing youth, representing older people. So we had the dementia-friendly people, we had youth workers. That's the first thing. I think it's that core team is absolutely critical, because those are the people who are going to be the conduit to the partner looking at you. So that really is the first thing. And then just being very receptive, being very open with, you know, what your issues are, but not dictating the issues to the people. Just, you know, to the students, we gave them the data. We didn't tell them what our issues were. We left that for them to find out. And I think you need to do that. It's too tempting to say, well, these are our issues. All you need to do is give them data and then answer questions. So those are two things I'd say.
Wonderful. Karen also asked, she said, it sounds like this was well received in the community. What groundwork was instrumental in this success?
Well, we have a strong community partnership that I chair, which is sort of part of the town council. And so the community, if we pull an event together, the community are aware of that. We have a conduit to the community. You know, I mean, I would suggest that not all of our community know about this project, and we want to make it known wider, but you know, you're only going to hit those interested people. But the impact of the things we find and the solutions are going to impact on the rest of the community. So I just think, you know, having a group that can organize this and go out to the community and try and involve them is really useful, really important.
That's wonderful. Okay. I don't see any other questions coming in. So I'll just, if anyone has any other questions, you can still add in the chat box, or feel free to email us and we can get you in contact with Keith and or Jean. But we are going to end a little bit earlier today unless anyone has any other questions. So Keith, thank you again, especially from GRNEN. We loved having you and we appreciate your time today. It was a wonderful presentation. We do have one more question. How did the students enjoy this partnership? How will it impact their future as a nurse?
I think they really did, actually. They were extremely hardworking. I mean, I haven't met them physically. I've only met them, you know, via Zoom. But I mean, they were a joyous group. They really were. You saw Poppy. They were very, very bright. They really got into it. They absolutely loved it. You could tell from our point of view that they found this a fascinating experience. And we said to them, look, you know, if you're ever in the UK, come and stay with us. And I think they will. You know, I think they absolutely got under the bonnet of our community in all sorts of ways. And I think they feel quite a fondness for us, which is really sweet. So yeah, I think they really did enjoy it. As in terms of their impact for the future as a nurse, well, you know, I'm not a nurse trainer, but you know, I think it's given them a much wider perspective of different communities' health needs, and also, you know, how health systems work in different countries, and also perhaps the similarities that I mentioned, that issue of mental health and young men, especially the issue we have, especially after COVID. We've all been affected by COVID, and we've all been affected in many ways the same. So although we have differences in our different countries, a lot of those fundamental well-being issues are going to be the same. And I think that's opened their eyes a bit to that, I would say. Hopefully it's given them much more worldwide perspective, which I think is very good, not, you know, stops them being parochial, perhaps. That's my view on it. And I have my squidgy brain, by the way, which they sent us, which is wonderful. That's in the doctor's surgery. Every doctor in our surgery has one of these worry brains, which you can squeeze. I'm sorry, it doesn't come out very clearly on the webcam, but it's lovely when you go into the doctor's surgery and there it is sitting there on the desk.
That's wonderful. All right. If anyone has any other questions, please let us know. You can email us at info@grnen.org. I'll put that in the chat box as well. It was wonderful having everyone here today. We hope to see you for any future events and hopefully to chat with you on our networking platform. And so Keith, if you have anything else you'd like to add to that.
No, just thanks for listening. I'm sorry I couldn't see you all. It's horrible talking to a screen and not seeing the people you're talking to, and I apologize for that. But there you are. That's the system, isn't it?
Wonderful. Well, thank you all again, and thank you, Keith. Again, if anyone has any questions, please let us know, and we hope to see you at the next event. All right, everyone have a lovely day.
Thank you all.